Maximizing fertility, 10 best times of the month to increase your chances of getting pregnant. When you're trying to conceive, timing is everything. Understanding your menstrual cycle and pinpointing the best times for conception can significantly increase your chances of getting pregnant. 1. During ovulation. Ovulation is the prime time for conception, occurring around the middle of your menstrual cycle. Track your ovulation using ovulation predictor kits, charting your basal body temperature, or monitoring changes in cervical mucus consistency. Having intercourse during ovulation gives you the best chance of fertilizing an egg. Number 2. 2 to 3 days before ovulation. Sperm can survive in the female reproductive tract for up to 5 days, so having intercourse in the days leading up to ovulation can increase your chances of conception. Aim to have sex 2 to 3 days before you expect to ovulate to ensure sperm are present when the egg is released. Number 3. The day of ovulation. Having intercourse on the day of ovulation itself provides the highest likelihood of conception. If you're unsure when you ovulate, consider using ovulation prediction methods or fertility tracking apps to identify your most fertile days. 4. The day after ovulation. While the chances of conception are highest on the day of ovulation, having intercourse the day after ovulation can still result in pregnancy. Sperm can survive in the reproductive tract for several days, so there may still be viable sperm present when the egg is released. 5. Around 14 days before your next expected period. If you have a regular menstrual cycle, ovulation typically occurs around 14 days before your next expected period. Tracking your cycle and having intercourse during this time frame can increase your chances of conceiving. 6. When you experience Mittelschmerz. Some women experience ovulation pain, known as Mittelschmerz, which can occur around the time of ovulation. If you notice this pain, it may indicate that you're ovulating, making it an ideal time to try to conceive. 7. When you notice changes in cervical mucus. Changes in cervical mucus consistency can indicate your fertile window. As ovulation approaches, cervical mucus becomes clear, slippery, and stretchy, resembling egg whites. Having intercourse when you observe these changes can improve your chances of getting pregnant. 8. When you have a positive ovulation test. Ovulation predictor kits detect the surge in luteinizing hormone LH that occurs before ovulation. A positive ovulation test indicates that ovulation is likely to occur within the next 12 to 36 hours, signaling an optimal time for conception. 9. When you experience an increase in libido. Some women notice an increase in libido around ovulation, often referred to as the fertile window. Pay attention to your body's cues and take advantage of increased sexual desire to maximize your chances of conceiving. 10. Throughout your menstrual cycle. While the days leading up to and including ovulation offer the highest chances of conception, having regular intercourse throughout your menstrual cycle can increase your overall likelihood of getting pregnant. Consistent sexual activity ensures that sperm are present when ovulation occurs. Conclusion. By understanding your menstrual cycle and identifying your most fertile days, you can optimize your chances of conceiving. Whether you track ovulation using methods like basal body temperature charting or rely on ovulation predictor kits, timing intercourse strategically can significantly increase your likelihood of getting pregnant. Remember to prioritize self-care and reduce stress during your conception journey, as stress can impact fertility. Consult with a healthcare provider if you have concerns about fertility or need guidance on optimizing your chances of conception.